The impulsivity and distractibility seen in some kids who learn and think differently can put them at greater risk for accidents and injuries, including head injuries. Now that kids are back to playing sports, I thought that it was important to talk about those head injuries and about how to support young people who've had injuries. Today, my guest is Dr. Talin Babikian. She is a board-certified clinical neuropsychologist with over 16 years of experience working with children, young adults, and their families. Dr. Babikian is an associate clinical professor in the Division of Child and Adolescent Psychiatry at the David Geffen School of Medicine at UCLA and associate director of Brain Sport at UCLA, an interdepartmental and multidisciplinary program for identifying and treating brain injuries, including concussions, in youth and professional athletes. Our conversation today dovetailed into a conversation about how to support kids' mental health challenges associated with the head injury and those experiencing similar difficulties related to environmental stressors. We have some great resources in the show notes, so be sure to check them out. I am absolutely thrilled that Dr. Babikian is sharing her expertise with us today.
Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Hello, Dr. Babikian. How are you?
Hi, good. Thank you. Thank you for having me.
Thank you for coming on the podcast. I'm so excited that you're here.
Likewise.
And, before we actually hit record, we've been talking via email, and I said we're going to talk about all things neuropsychology and head injuries in children, but we are also going to bring in the piece about kids who think differently, particularly kids with ADHD, and then also the mental health piece. And so we're going to tie it all together because people might be listening and wondering, why are we talking about head injuries on a podcast about learning disabilities and kids who think differently? But it's related, and we're going to get to that, right?
Absolutely. Absolutely. We're going to try to do all that in a short span of time, although I think all of these areas deserve their own hour-long discussion.
They do.
Let's jump right in. It's an area that I'm very passionate about, so I'm very excited.
Yes, me too. We might have to have like a part 1, part 2, and part 3, depending on how the conversation goes. But there's just so much to talk about. And again, I'm just glad you're here. And I think it's an important one. We're still on the tail end of the pandemic, at the time we're recording this. And many kids are starting to go back to playing sports. And that's important because, we're talking about, head injuries, mild traumatic brain injuries, and these injuries can be caused by recreational activities like riding a bike, skateboarding, skiing, all of those activities. And I think about half of concussions occur in children who are playing organized sports like soccer and football. And so it's kind of top of mind as kids are transitioning back to sports to talk about what that means. When we talk about a traumatic brain injury, that may sound very scary, and concussion sounds less scary, but it's not less severe. So I would love for you to talk about what we mean by traumatic brain injury, what we mean by concussion, to kind of start things off.
Sure. So traumatic brain injury is, as the name implies, any injury where the brain moves inside the skull. So we can have a very, very mild version of that, although, a brain injury is a very serious event and should be taken seriously. But within that, we can have very mild outcomes. So, about 70 to 80% of all injuries are mild, and about 70 to 80% of those are injuries where kids recover from fully. Okay, so it takes up a large proportion of incidences. So a brain injury is any movement that causes the brain to move in the skull. And as you know, the brain is sitting in fluid in the skull, so it's meant to move. Our physiology is designed to withstand some level of impact, right? Otherwise, every toddler would be walking around concussed and we would have a major, bigger public health issue. It's only when that movement is significant enough to cause some difficulty in functioning. So in mild traumatic brain injury, also known as concussion, those two terms are often interchangeable. There's a temporary change in function. So it's a disruption in how the brain is using energy to function, how the brain is regulating itself. And we know that it's a time limited process. And just like if you shake a snow globe, if you put it down, all those snowflakes will settle down. We know that they do. And that's the most common outcome. From there, we have more severe injuries. So if there's any kind of impact where there's a bleed, or if there is a disruption in connectivity, whether it's functional or structural damage, that causes scar tissue, that could lead to more significant permanent outcomes. And then there are secondary things that could happen from a brain injury. For example, a seizure disorder may develop, or some other neurologic issue may develop. So it's a wide spectrum.
Right.
And again, the important message is that most kids with a brain injury tend to have a mild version. And with that, they also tend to fully recover. And that's really important to highlight.
Yeah. And that is really important. And I think it's really clear from what you've said that a concussion is a mild traumatic brain injury. They're not two different things we're talking about. But also what I'm hearing from you is that even though it's considered a mild brain injury, that we shouldn't treat minor injuries as something that's not important, because it really is related to there are changes in the brain associated with that.
There are. So in that period when the brain is feeling that dysregulation and that disruption, it's really important to identify that a concussion has happened. So we keep the person from going back and having another injury that complicates the picture. And then accurately labeling what's happened. So the psychoeducation around it is critical. So if we describe to a young person and their family, here's what's happened, here's the typical time course, here's what we expect, here's what we would like you to do. We would like you to do it in a graduated, safe fashion. It's critical in their recovery. A lot of messages families get is to withdraw the child from any activity, and that actually tends to make outcomes worse. So that initial identifying a concussion correctly, labeling it accurately, presenting what's expected, all of those things are incredibly important in how someone will come out of an experience like that.
Okay. And, the other thing that I think, based on what you just said, is that we really have to understand what those symptoms are. So labeling it and understanding it. So what does it look like? If a child has fallen on the playground and parents wonder, is this a concussion? Is there something I should be concerned about? What are some symptoms, some things that they should be looking for that indicate that there might be a mild traumatic brain injury or a concussion as a result of a fall off a skateboard, on the playground, or while playing sports?
Any change in mental status is a sign that something may have happened that's significant. And I would say if there's any concern, even if the parent or the teacher doesn't notice symptoms, but the impact looks significant, I think it's important to get that checked out. Because, I always want to step back a little bit. The dichotomy of, is it a psychological symptom versus neurological? Is it organic or environmental? It doesn't really apply in concussion because or any major neurologic condition, right? It's one nervous system. So
Right.
if we think about what a concussion is, which is kind of shaking up, rattling that system, it's no wonder that the symptoms are going to also be very wide. So they could be in the area of cognition, slow thinking, difficulty remembering things. It could be disrupted sleep. It could be disrupted mood, any kind of irritability, or depression or withdrawal. It could be a number of things like pain and headaches. Um, very wide in scope, and every child presents differently. So again, any change in that person's behavior relative to what they were. And this is where coaches and peers and teammates come into play, because they know the player, they know their friend, they know their teammate. And so any subtle differences in how they're acting, how they're thinking, what their balance is like, what their coordination is like, is a sign that there may have been a concussion. And withdrawing that child from activity so that they can be checked out is critical.
Right. And again, what you're describing is a change in their behavior, a change in the way they're processing information, the way they're acting, a change in their mood signals that there could be something going on as a result of that injury. And when we think about the brain, we think about it's inside of a skull, and the skull is designed to prevent most traumas to the brain, but it really doesn't prevent the brain from moving around inside the skull like you've described. And it's that movement that is really causing the cognitive difficulties and social emotional problems that you've described.
Yeah, which is why helmets are incredibly important, right? But they don't necessarily prevent the movement of the brain and the skull. And so sometimes, just by wearing a helmet, there is a false sense of security that someone is safe from concussion. They may be safe from fracturing their skull or sustaining a more severe injury. I mean, they're absolutely critical in terms of public health, but they're not foolproof against a concussion. And there shouldn't be a false sense of safety around wearing a helmet.
And I think that is so important for parents to know, for educators to know, because I think there is that sense that, even if a fall occurs, that it can't be that bad because they were wearing their helmet, but the injuries can still occur. And the other thing is that, when kids have these incidents, these accidents, parents might take their kids to an emergency room, and they expect, if there's really been a concussion or a mild traumatic brain injury for that matter, that something should show up on a scan. Some parents will want a scan done to show that, to determine whether or not there's been an injury. But I think what most people don't know is that you can't see a concussion specifically on, those imaging tools that we use, like an MRI or a CAT scan.
Yeah. So an X-ray, like a CT scan, is really good in identifying bleeds.
Yes.
Big bleeds, not the micro bleeds, right? And an MRI may be really good in identifying the micro bleeds. But those tools are not very specific to concussion. So parents will come and say, I read this article where there's a functional MRI test that can be done to look at connectivity. It's like, well, yes, but those tools aren't ready for prime time clinical diagnosis. They're interesting, they're intriguing. Again, there's a signal that can be picked up, but sometimes we're not sure if the signal is concussion versus some other neurologic event like a migraine or some other autonomic dysfunction. A concussion is a clinical diagnosis made solely based on someone's symptoms and behaviors.
Right. And so it's not identified and it's not diagnosed using those tools that you've described, an MRI or a CT scan. And that's where kind of the assessment for an injury, a concussion, is so important, so that we know what it is that has occurred, so we can treat it and give the brain the rest it needs to recover.
Exactly. And that's the acute phase. And then once we get into longer phases, again, most concussions recover. Kids take a little bit longer to recover than adults, but we know that window of time. So past that window of time, we'll get kids who aren't recovering. So if they get to 2-3 months post their concussion and they're still symptomatic, then labels like post-concussive syndrome can be used. But again, even that bucket isn't one bucket. There are lots of different ways someone could end up in that bucket of chronic symptoms. Sometimes it's a migraine disorder that they were predisposed to that's now triggered. Sometimes it's an autonomic dysfunction that they may have had some vulnerability to, whether it's genetic or some other reason that is now being triggered. Pre-injury anxiety, a tendency to catastrophize, to ruminate. All of these things are incredibly important, not to mention the role of the family environment. So kids who come to a concussion, for example, who have a pretty significant trauma history or a chronic stress history, have a nervous system that's very hypervigilant. And so anything that happens, whether it's a concussion or some other thing, their nervous system is just wired to adopt symptoms and hold on to those symptoms. I often describe this as, it's like a fight or flight response is like a smoke alarm, right? And at certain times in a kid's life, that hypervigilant smoke alarm can be very adaptive. But if it's a chronic situation and they're constantly hypervigilant and everything seems like a threat, it's their nervous system is in overactive mode, right? So that any little dust particle that goes by that smoke alarm is going to set it off, and that's not very adaptive. So there are lots of different pathways to ending up with a concussion that's not healing, that we're figuring out now and trying to understand. But the big picture, the important piece is that every kid comes to that point from a different pathway. Not all kids who are not recovering have arrived there with the same pathophysiology or neurobiology. And I sort of understanding that big picture, the context is really important so that the interventions can be more targeted.
Right. And, you talked about that window. And so when kids are outside that window, they've had a mild traumatic brain injury, a concussion, and the symptoms for most kids would have resolved by now. And if the symptoms are persisting, it sounds like there might need to be a follow-up to determine some of these pre-existing stress factors or pre-existing environmental factors that might be playing a role in the persistence of symptoms beyond what we would expect.
Absolutely. And I think the sooner that's done, the better. Because what happens when kids aren't getting better, there's this rise in anxiety, of concern that they have themselves, that they pick up from the media, that they get from their caregivers, the rise in anxiety and concern in parents. And that's just a negative feedback loop of shifting the focus from what would be helpful to them and in line with treating them to now being a risk factor and prolonging symptoms. So that, again, that psychoeducation piece, that clinical sensitivity early on and identifying kids that may be at risk, intervening early, using correct language, accurate language, putting information they may get from the outside world, whether it's media or other people, in context. Doing that early is really important.
Now, on this podcast, we talk a lot about kids who think and learn differently. And I wanted to talk to you about ADHD specifically, the relationship between ADHD and concussion, because I think some parents who come into our office and they have kids who struggle with attention issues, they'll report a number of accidents that have occurred because their kids weren't paying attention. They weren't looking where they're going. They were distracted. Are those kids more prone to concussion? What is the relationship between ADHD and concussions? And then when kids with ADHD do get concussions, does the sequelae look different?
So lots of good questions there. If we focus only on concussions, which is those mild injuries, yes, there is an increased risk of kids with ADHD to be injured just because of their impulsivity and hyperactivity. Obviously, not every kid with ADHD, but those who have that particular profile. So, yeah, they're slightly at higher risk for getting injured. And if they happen to hit their head, then they'll have a concussion. They're no more likely to have a concussion than other injuries, right? Which is why studies that study concussion make sure that their comparison group can include an other injury group because they're demographically, clinically, behaviorally similar. Concussion itself initially may trigger some symptoms that may seem like the ADHD is exacerbated. But if we look long term, a single uncomplicated concussion doesn't exacerbate underlying ADHD or learning disability. Again, in those straightforward cases, it's a temporary event and it comes, if it's managed well, put in the right context, it's resolved, and then the child can go back to who they were and what they were like before. That's concussion. If we talk about more severe injuries, then the link between a new ADHD diagnosis and the brain injury is more substantial. Again, not every kid, it depends. And then the ADHD that you see or the learning disability that you see post brain injury can also look different than a developmental ADHD profile or a developmental learning disability profile. So, a lot of times I see kids who are in the school system who've had a pretty severe traumatic brain injury, and they're treated like the other kids with ADHD or any other neurodevelopmental condition. I think it's really important for educators, for parents, for clinicians to recognize that although the labels may be the same, some of the presentation may be different.
And how might that presentation differ for kids who, for example, had, a developmental ADHD? So they were diagnosed in childhood in the absence of a head injury versus a child who has a head injury and then develops symptoms that look very much like or identical to ADHD.
So I think the differences are subtle, but important in a given child's educational plan. So kids with a traumatic brain injury presumably had a normal, typical development. So we would have expected them to have acquired things like reading and executive functioning skills at an age-appropriate level. And then this thing happens that completely disrupts their trajectory. That's very different than a child who has sort of developmental peaks and valleys and skills that have been the case across the board. So, pre-injury learning in a brain injury is typically preserved. So, for example, if a child has a very severe injury at age 8, we would expect them to have preserved whatever they had learned until then. So things like reading and phonics, right? If the injury didn't occur until they were 16, then more of those cognitive skills that would have come online, like executive functioning and attention and self-regulation, once those are online, then more likely than that they're going to be preserved. So there's a timing difference. I think some of the other ways, the learning disability or ADHD may be more focal in the disruption as opposed to a brain injury where the impact is more diffuse. So children with a brain injury may have global deficits, for example, in processing speed or working memory that's more diffuse and impacts just kind of the foundations of cognitive functions, whereas children with ADHD or a specific learning disability may have, again, more peaks and valleys, things that they're stronger in and other things that they're weaker in. Those are the major ones. And then there's obviously an emotional component to this. So whether a child has been dealing with a developmental disability all their life versus another child who has had to deal with the loss of who they were. The emotional reaction to it is going to be very different too, right? The sudden change in their identity, in their school identity, and their peer identity, in their future prospects.
Yes. And I love that you're talking about that emotional piece because, I think people who are looking at a child who suffered an injury might be thinking that emotional response is a reaction to the injury. Now I can't play football for a certain amount of time, or now, it's harder for me to concentrate. But I think it's important to understand that those emotional changes and those behavioral symptoms can be directly related to the injury and not a response to the injury.
It can be both.
Right.
And I think identifying both is important because one provides a path to an intervention, right? So if it's environmental and if it's reactionary, if it's situational, if it's secondary to, their feelings about things they can or can't do, that can be intervened. It's harder to intervene if it's more biological. And my sense is that I think we often overlook what the environment's impact is because it's sexier to look at, brain imaging and connections. But I can't stress how important the environmental impact is on the meaning making of an injury like that. Obviously, all of these take time, but there's a tremendous amount of impact. Caregiving, problem solving, support, peer interactions, mentorships, self-agency, self-efficacy can have, even in the context of a traumatic event that's very scary and has pretty significant consequences on a child's life. But those are all areas that can provide the child and their family some tools to be able to make meaning out of what's happened and move forward in a way that's more adaptive and positive, and in some cases even can build resiliency.
Mm-hmm. And that intervention, that environmental focus and that support that's in place, it seems like that can mitigate the mental health issues that can result from concussion. And speaking about mental health, I'd love for you to talk about the connection between mental health and concussion.
Sure. Yeah. So we talk about concussion, but this could apply to any medical condition or big stressor. So if we step back and look at the literature that predicts mental health in youth, so the risk factors are things like a parent with a mental health issue, anxiety, depression, right? Anxiety in the child, lack of connection with peers, poor academic achievement, stressful environment, poverty, and everything else that comes with that. Those are all risk factors for mental health in youth, independent of concussion, right? And then if we also look at the resiliencies. What are the protective factors when we're looking at mental health in youth? It's connection to peers, something in the community, high academic achievement, self-agency, right? Having at least one person, adult, who they feel cares about them. If we have time, I'll give you an anecdotal story. These are all protective factors. So if we think about something like a concussion that's happened, or again, fill in the blank with any other major stressor, we can see that a concussion exacerbates all those risk factors, right? We withdraw kids from their sport. We withdraw them from their social functioning. We create a lot of anxiety about their future. Are they going to be able to go to college? Does this mean the end of their football career? A parent who's really stressed out or depressed or not available, right? And then the protective factors are also impacted. So now all the things that brought them joy and self-esteem and kind of fill that self-esteem bucket is now taken away from them. So no wonder youth with concussion are at risk for mental health issues, and in some cases, pretty significant consequences like suicide. But the connection isn't necessarily the injury itself. It's the mediating factors that we know are a risk for mental health issues.
And I think that you've just described what so many students have faced during these past 2 years. If I think about the pandemic and the stressors associated with that, the loneliness, the isolation, the inability to do all the things you would normally do, and how those stressors have contributed to mental health. I mean, we know that there have been significant mental health issues as a result. And it sounds like there are also some protective factors and some environmental things that we can do in a child's environment to buffer against those stressors and to support them as we recover from this period of stress.
Absolutely. If I may tell a story,
Please do.
Before I did neuropsychology, I was involved in some international research because I wanted to travel a lot. So we were looking at HIV risk in youth across the globe, in areas where HIV was a big issue. So parts of Eastern Europe, the Caribbean, parts of Africa and Mexico and the US. So HIV risk in those populations really varied depending on the political, social, economic environments, right? So in the Caribbean, the average age for sexual activity was much younger, for example, than in Eastern Europe, where drug needle use for drugs was more common. So we couldn't come up with one profile. But the only thing that was consistent across all of these cultures was the kids who could identify one adult in their life who they felt connected to, who they felt cared for them, were at lower risk. And it didn't matter who the adult was. Sometimes it was a biological parent, but it could be a priest, a coach, a teacher, an aunt, a grandma. So that's always stayed with me because it's a consistent finding in literature that connection, even if it's to one person, is really important. And when we talk about mental health in youth and concussions, sometimes the biological parent can't be that for whatever reason. They may have their own issues, or they work a lot, or they're just physically or emotionally not available. But there's an opportunity for coaches and teachers and mentors and school personnel and therapists to offer that role. And I can't stress how important that is in things like concussion, to have that same sense of connection and safety to something that is fulfilling to kids. I think it's critically important.
And I think that is the outcome we want, right? We want kids to not only recover cognitively, but we want that agency and that self-confidence, and we want them to be free of the sadness and the anxiety that they've been experiencing so that they can live fulfilling lives.
Yeah.
And it just seems that there are things that we can do and put in place to support kids, whether they're struggling with mental health issues or whether they have had a concussion and they're recovering from that concussion. It sounds like the support that is needed is very similar.
Exactly. And, we can't tackle, when I was listing the risk factors of poverty and discriminate. I mean, there's so many things that as a society we need to deal with, but as individual providers, we can't tackle all of that and we can't change that child's history, but we can be that bond. And that just takes genuine effort and compassion. And anyone in a role interacting with a young person can offer that.
Absolutely. Absolutely. And I think that that's a great place to end. And this has been so informative. It's been a wonderful conversation to have with you. I feel like there's so much more we can talk about, but this is a great part one. It's a great step. And I think you've helped us recognize what a concussion is, the importance of evaluating it, identifying it, and also even, I think, most significant is providing the level of support that's needed after a concussion when a child is experiencing a mental health crisis. And there are things that we can do to support. And what I'm hearing from you is one of the important things we can do is for that child, that young person, to have a connection with an adult, with someone who can be in that supportive role, someone that they can connect with that will help them through a difficult time.
Absolutely. Yeah. Well, thank you for having me. Yes.
Thank you for being here. And if listeners want to speak with you further, what is the best way for them to reach you?
My email,
okay,
which is my first name at myfirstandlastname.com. Fairly easy to find on the internet.
And I will put it in the show notes so people can reach out to you. Thank you so much for being here.
Thank you.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.